Good afternoon, everyone. How is everyone doing? Happy Thursday. Natural Holistic Fertility Solutions. We are talking about fertility health. This live is for those who are trying to get pregnant and looking for solutions, answers. Um, yeah, natural ways to improve and enhance your fertility using natural holistic solutions, medicines, therapies, treatments, coaching. That's what we are discussing here. My name is Ashish and I support women and couples going through fertility issues with natural medicines, natural therapies, treatments, Ayurvedic medicines as well, and coaching and consultation. So, what is your biggest question today? What is not working in your fertility health? What kind of things are you dealing with right now? What kind of challenges are you facing at present? That's what we are discussing here. So welcome everyone. Feel free to ask a question, share your journey, your experience, your confusion, whatever you want clarity on, feel free to share that here. I will also share my website here for those who want to check it out. Check out, we have got a number of guides available, we have got a number of herbal medicines available also on our website as well. So do check out. ashishveda.uk is the website, and check it in your own time. So, question. Who has a question? What is your confusion? What are you trying right now in your fertility journey? What procedure? What investigation? Where is your journey halted maybe? Or just paused for now? Good afternoon. How is everybody doing on a Thursday? Fertility health. We're talking about fertility health. How can we make your fertility journey better, smoother, easier, simpler, holistic, natural, so that there are less side effects, so that there is less tension, there is less stress than what it is. It does not have to be excessively stressful. And that most of the stress comes from when you don't know, you don't have the clarity, you don't know which way to step forward. When you have the clarity, when you know which way to step forward, that's when you know that, okay, at least for 1 week I know I have to do this, at least for 1 month I know I have to do that. That's what we are discussing here. So questions. Who has a question related to your fertility health? What is not working in your fertility? Feel free to share. Thank you. Likes, hearts, gift, sharing. Thank you. What's your question? How can I help? Who can I help today? Fertility questions, fertility confusions. We're talking about fertility health. If you have got issues related to your fertility that you're not able to get pregnant faster, healthier, then feel free to share. Thank you for sharing. Who has a question? A.M. How long should be taken letrozole to help with pregnancy? 1 or 2 months? A.M. Did you hear my answer? A.M. The protocol for letrozole clomid is maximum 3 months protocol. Anybody who's using more than that should not be using it, because you cannot stimulate ovaries that much. So you use it 1 month. Even using 2 months sometimes may be too much for some patients. So dependent on your health. If you're very sensitive to hormones, even 2 months is a lot. So you should be doing other things alongside, so that it is when you stimulate it, then it still has an impact in the months to come. It's not just stimulated then and then, it will still keep that for next 2-3 months, but you can't use it more than 3 months. I know that it is given, sometimes patients are using it for, I don't know how, even by themselves, or they are taking it months and months on end. You shouldn't be doing that. Thank you. What's your advice? Trying everything to fall pregnant is not happening. Tell me, what have you tried so far? And what does the sperm numbers look like? How long have you been trying? What other investigations have you done? What has happened so far? Fertility health? Anybody has a fertility related question? Experience, observation, thoughts? That's the topic here, fertility health. A.M, yes, sure, you can do a consultation in private. I've shared my website here. Do go and check everything related to consultation, and then you can book for sure. How are you? I'm very well, thank you. Saima or Salma? Saima. About my fertility, second baby conceive, right? Can I get one? We are talking about fertility health, fertility solutions. If you're trying to get pregnant faster, for those who are struggling, those who have been trying for many months and years, we are discussing, that's the topic here. Anybody who is not related to that topic does not have to be here. Yeah. Thank you for the gifts. Saima, what's the question? Saima Fatima Nabil, what is the question? You're trying to conceive second baby, right? So what investigations have you and your husband done so far? Nuri, no, I am not doing reading. I am not a psychic or tarot card reader. We are talking about holistic health. Who is struggling to get pregnant, and what is your question? What are you doing to improve your health, which includes your physical health, mental health, psychological health, sexual health, relationship health, your work environment, health of your work environment, health of your home environment. It involves all kinds of health. And how are you improving on all those factors? How are you optimizing your living so that your living becomes really healthy? Your day becomes almost like a therapeutic day if you're doing everything at the right time, suitable for your body mind constitution. So, how are you doing that? Hi there. Why are my comments not coming through? I have no idea. Hello. I can see this comment. If you typed something else, I haven't seen it. Dinsa. I have been on vaginal progesterone. It's giving me eczema flare up. Is that normal? It can happen, yes, because it's a hormonal medication, and it causes more, it causes more, what's the word? Water retention. So eczema can get worse, yes. Okay, type something different. Type few words at a time. It just seems that online we can talk about all kinds of other rubbish, but we cannot talk about proper medical things. So sometimes when you're mentioning sex and sperm and egg quality and this kind of stuff, sometimes it automatically takes those comments out. I'm not blocking anybody's comments. I will block people, the ones who are rude and are not suitable on this live. Those I block directly, so there is nothing to engage there. But otherwise, all other comments, if you want to ask a question, feel free. Why I type a lot is not coming, so trying to shorten it. Yeah, now it is coming, like when you're typing in like this. Every platform has their own issues. LinkedIn has blocked. I was sharing about yoni oil, so they removed it, and they have removed other posts in the past as well. So it's just ridiculous. Hi, Dr. Can a 47-year-old woman get pregnant? Yes, with a lot of effort. You will have to do a lot of things to be able to get pregnant, stay pregnant, and you have to be very, very fit. Both, actually, both partners. Okay, having regular period, but on coming negative on LH strip. Don't do strips. Do body temperature. Do you know the signs of ovulation? It may be that you are ovulating, but strip is not capturing it. Strips are only correct for 20% of the women who do get ovulation on day 14. Rest 80% of the women. And we are not clones, Everybody's ovulation may be a day early, day late, 2 days early, 2 days late. Not late, 2 days after 14, so it could be any time, 7th day, 8th day, 9th day, 10th day, up to 14, 15, 16th day. Chart your own temperature and look at your signs of cervical mucus. When you start to release cervical mucus, your fertility window is 2 days prior to that. Lela, yes. I have PCOS. I hate birth control tablets. Every doctor just gives me that. What can I do? Go to a holistic practitioner. Start working on your health. Don't take a pill. Doesn't do anything for PCOS. Makes it worse. Where are you based, Lela? Hina, 8.5 HB level. Is it normal in pregnancy? No, it's quite low. So your HB is low. How many months are you pregnant? I am in Canada. There are practitioners in Canada. Otherwise, you can consult with me for sure online. Find somebody. I have herbalist friends in Canada as well. Any medical doctor in this day and age, who's giving pill for PCOS is just, I don't know why and how they are even doing that. It's just crazy. Thank you, I will. Okay. You're welcome, Lela. Hina, 6 months? 6 months, what? Oh, okay. Are you vegetarian or not eating well? What is happening? Why is hemoglobin low? Any other question? My mom thinks I'm too old to get pregnant at 36. Which country are you in? I feel so positive when I watch your videos. Thank you. Which country are you in? UK. Right. And your mom? Natural holistic fertility solutions. Anybody has a question? Otherwise, thank you for being here. Do you do fertility checks? We do fertility checks as well. We do have a partner clinic for all the checkups, and I do natural assessments, health assessment, overall your health assessment based on Ayurvedic principles as well and natural health principles as well. And then medical tests you can also have. Yeah. Here's the website. Once again, anybody wishes to reach out for a one-to-one consultation, want to check out other solutions and guides, and we have Go Herbal Medicines available as well on the website also, so you can directly order if you wish, or if you want proper help one-to-one after a consultation, you want to do all of that, that is also possible. So do reach out. Last minute question anybody has? Otherwise, thank you everyone. Mary, what is the benefit of the oil? Which oil are we talking about? Yoni oil, right. So the yoni oil that I prescribe and recommend, it is for if there is an issue and if we are trying to reduce inflammation, trying to improve vaginal health, improve vaginal microbiome. It is for all those purposes that we use. Mary, sometimes we can test. You can test for vaginal microbiome. You can also test the pH. You can, if tests are required. Sometimes we don't do any test. We are just doing everything possible to improve health in every possible way. So then you don't require any of those. Sometimes the patient's case history gives away that, okay, maybe if you have had a lot of UTIs, if you have had vaginal infections in the past or even recently. Otherwise, you can test for everything that you want. Can I buy the oil on its own? No. It's part of the whole set. I have got lots of UTIs. Right. Getting excessive amount of any kind of infection or urinary tract infection, then something is not balanced there. And there is microbiomes which are not microbiome which is not balanced. There is bacteria, viruses, fungus is part of our every tissue that we have in our body and on our body as well. Yeah. So if you're getting consistently UTIs, that means there is something going on. Also, if you're sexually active, then you might be picking that up from your partner. They could not find anything. What have you tested? UTI also can be a gut health issue. They could not find anything with you or your partner. And what kind of investigations have you done? Any kind of recurrent infection is not good. Anything. Right. So what investigations have you done? Blood test, urine test, and ultrasound. You need to test for specific tests to do with the microbes, which is also part of urine test, stool test. Maybe something in the way you are doing things, maybe some kind of product that you might be using which is causing it, something is causing it. Yeah. Maybe gut health is causing it. Maybe your kidneys are not functioning very well, that can cause UTI. All right, everyone. Thank you. Speak soon.